So, speaking about how challenging the pandemic has been, and this Omicron variant is really, I feel like it's somehow threatening to force us to go back to like progress that we already made. In your opinion, in your perspective, what can the healthcare system across the country do to attract more staff, especially now that a lot of people maybe considering healthcare as a career are, scared of getting infected, of putting their families in danger, all these things?
We need a lot more people in healthcare, not less. And so hopefully there's a lot more thinking of purpose. We all talk about purpose in life, and it's great to wake up in the morning and to wake up with a purpose, wake up with motivation and make a difference. And healthcare workers do make a difference. So I do hope that there's more and more individuals and our youth wanting to get into healthcare. But that might be the $1 million question. I think there are a number of issues that need to be addressed to improve the healthcare sector and attract more staff. One, there needs to be attractive and competitive wages to help recruit new staff and retain current staff. Obviously, good wages need to be paired with good working conditions and benefits. And we know healthcare providers have been working extended hours for many months now, and even prior to the pandemic. I think provincial governments should consider keeping some of the wage hikes it introduced during the pandemic to keep and recruit healthcare workers and properly recognize their contributions. Keep the pay hikes in place. Two, I think we also need to invest in more physical infrastructure, hospitals, clinics, long-term care facilities, and more. We have a growing population, and our hospitals have often been at near capacity pre-COVID. Many experts expect more pandemics in the future, which means our facilities need to increase capacity, particularly with respect to ICU beds. And so that's very important. I also believe our post-secondary institutions need to keep pace with the needs of our communities. I know a lot of students want to get into medical school. Here in my home province, a lot are refused. Bright students, why are they refused access? I think we should look at growing more homegrown talent in our universities and changing that ratio. I do understand some of the universities fund their budgets with international students, but we need more homegrown talent. We need more doctors and nurses and healthcare workers. So I think many are not served properly when it comes to doctors and nurses and LTC staff because there isn't enough. For example, medical schools should allow, like I said, more students and not limit admission enrollment to help alleviate the current and future gaps in healthcare services. Obviously, this challenge is not unique to doctors. Programs that offer diplomas, certificates, and degrees in all healthcare sectors should try to keep up with the demand, not just doctors. And this can't be done without more funding and education and more teachers and professors. I think that's so important. It starts with teaching and professors. And one major issue which has been ongoing for many years is the recognition, and this is also very important, is the recognition of foreign or international credentials by the various regulatory bodies, national associations, and credential assessment agencies in Canada. Too often we hear of healthcare professionals from abroad not being able to practice in Canada as immigrants or new Canadian citizens because their credentials and work experiences are not being recognized or adequately considered. Canada expects to welcome 1.2 million new citizens between 2020 and 2023. Well, 2020 and 2023. We are in 2022 at this point in time. And that number would likely keep growing as immigration will remain a key part of our country's overall prosperity. So in terms of contributing to our healthcare system, these new citizens will need three specific things. And this is very important. And credential recognition, accessible and affordable higher learning opportunities, and access to employment opportunities. So important that, we fit in that immigration policy to what's needed in our society, in our communities, and healthcare workers are strongly needed at this point in time. So very important that this gets done and gets done quickly for that matter.
Mm-hmm. I like the part about the homegrown because I'm a big proponent of immigration, and absolutely. But I also know that there's lots of people here, and I think a lot of this sometimes is a case of where people have to realize that opening old doors don't lead to new ways, and so and that's our mindset as well. So the beauty of what we're trying to accomplish, really, at the end of the day, is saying that okay, we can absolutely facilitate the immigration situation with people that are landed in Canada, legal to work. We're going to help them. At the same time, for people who have been here, there maybe their whole lives or for at least many years, and they're up and coming, and the schools make shifts and adjustments to say, look, here's what's really needed. What are the skills that are going to be, in place for this? It means, and I think this is what the pandemic, I'm going to say this is the benefit of the pandemic, was that it really made people reevaluate things. Not just where they are personally in their lives, which is why we're seeing this big resignation and different things. A lot of people are reassessing, all that. So it has its ups and downs. But at the same time, too, I think it starts to make businesses, educational institutions and everything start to reevaluate and say, well, what does this country really need? What do we need to get back on track? How do we get prepared for the future? Because as you said, Tony, we're going to get other things like this. And are we prepared for the next wave? Whether it's the next current pandemic wave, or are we ready, let's say 2 years, 5 years, 10 years from now for something else that comes along? And it'd be unfortunate, but we have to be ready. 100%.
Well said. We have to be ready, and resources are important. Homegrown talent is important. And I think it all has to fit in and to really serve our communities properly, and that's so important, so key in doing that.